Dr. Ranjeet Brar joins us again now. Welcome back, Doctor. Tell us what you see in the latest curves. The government claim that their testing has been ramped up phenomenally, incredibly, and it was right to call them incredible because they turned out not to be credible, the actual claims that they made, but nonetheless, a vast increase in the amount of testing. They say that we're past the peak. Are we?
Thanks, George. Good to be back with you. Several parts to your question there. In terms of the numbers of cases we're seeing around the world, it still goes on, probably not at quite such a great rate. The rate of increase is still very large, but it seems that the curves are very slightly flattening in terms of their rate of increase, but they're still really, they are exponential. So there are more than 3.5 million cases worldwide. We know in Britain we've got test positive 280,000 patients, and we have had a variable number of deaths depending on which figures you look at. It seems that we're now just about to overtake Italy with 28,000, coming on 29,000 proven deaths, but that's just in hospital. And as we mentioned last time, the figures including care homes and including deaths at home are much more in the region of 50,000, making us really the second worst in the world. So the fact that numbers in hospital are declining, of course, is to be welcomed. But, you know, another piece of information has come out to show just what the implications of turning over our entire NHS to dealing with coronavirus have been. Before coronavirus hit, there were actually 4 million patients who were waiting for elective surgical care. The Royal College of Surgeons have released information saying that a further 2 million operations have been cancelled during this period. So really, we've only just managed to cope by putting the entire health service, if you like, on ice, other than for the most urgent cases. And there'll be a knock-on effect of that as well. The testing has increased, there's no doubt about that, but equally not as much as they have initially claimed. So they counted tests that they've posted rather than tests that have actually been performed, the results have come back on and they've enacted on, which is not really a very accurate way of testing. But tests are increasing, and now increasingly members of the healthcare service at least are able to access testing. They haven't all been tested. I've still got colleagues who haven't been tested. And again, it's the test which says if you're actively symptomatic. So if you've had it in the past, recovered, you don't know as a healthcare worker still whether you're protected or whether you're exposed. And as we've seen, a very large number now of healthcare workers, at least 100. There are studies which say they've identified possibly 200, but have only been able to contact and confirm 100 deaths in the NHS. So a large number of people working on the front line have succumbed. And really, this is still a very active problem that we're facing in Britain, George.
Have you ever known more than 100, 108 was the last figure I read, more than 100 NHS workers to die from a disease contracted, presumably, overwhelmingly likely, at work? Have you ever known of such a rate of attrition in so few weeks?
No, George, it's totally historically unprecedented. There's no infectious disease in the history of the National Health Service, which has certainly been around in its present time since the Second World War, in which members of the NHS, doctors, nurses, physiotherapists, healthcare workers of all descriptions have been succumbing. And there are worrying statistics about who exactly is coming down with the disease. It's increasingly obvious, evident from analysis, that it's the relatively poor, the relatively marginalised within Britain and around the world who are suffering most because they're unable even to socially isolate. We talked about the fact that so many of our children during the time when they're not meant to be at school have been going to get their school dinners because that's actually the only secure source of nutrition they had. But there are other things, overcrowded housing, increasingly people who can't afford not to stop working and are frontline workers in one form or another are more likely to die than others. But even within the NHS, there's very disturbing evidence from the BMA where they've seen that black and ethnic minority doctors have been more pressured to work in frontline unprotected situations than average, and therefore revealing an element of conscious as well as racism, as well as just a pure, this is hitting the economically most disadvantaged sections of our society. And that's a very unpleasant mirror to hold up to British society, George.
Well, let's disaggregate those 2 points. If you look at the London boroughs, if you look at the fatality rates in London boroughs, you can make an absolutely direct correlation between poverty, overcrowded housing, and the number of people dead. Newham is the worst. Tower Hamlets is the second worst. Hackney is the third worst, or the other way around. Richmond is the best. That's not rocket science, cannot be gainsaid. The second issue, though, is it the case that the disproportionate number of black and minority ethnic staffs that have fallen in this crisis, is that because of some genetic issue vis-a-vis the virus? Is it because we've got far higher numbers of black and minority ethnic people working in the NHS than those who don't use it hitherto imagined? Or is it, as you imply, that these are the workers that are being pushed by the management onto the most dangerous front lines?
Well, it's a very uncomfortable question, and I think it's one you have to face on. So I had been interviewed about this previously, and my reading of it was as a purely economic and not genetic, but there are several other issues. So, certainly South Asians tend to live in extended families in which we know there's interfamilial spread is a very strong factor. So the Chinese, in fact, didn't isolate people at home, as we've been doing, because they worried about them becoming unwell, being unable to properly isolate. So they isolated them socially, so they put them in hospitals where they were cared for, they had their needs cared for, and therefore were less likely to spread in the community, but in particular to their family units. And if you live in an overcrowded house with a large family unit, you're more likely to spread to the whole house, and equally to the older generation, and they're more likely to die. So that's an element. So there's a cultural element to it. There's definitely an economic element to it. And the comorbidities of cardiac disease, diabetes, hypertension, and obesity are all prevalent in our society in general, but they're particularly high in particularly, again, the South Asian community. So there's definitely an element of those things, which is understandable. But if you look at and I hadn't witnessed myself this personally, I have to say, but if you look at the BMA, they did a very wide questionnaire which they've published over the last few days of staff, and it does show disproportionate pressuring of ethnic minority staff to work in conditions where they've not been adequately protected. So that's their finding. It's an uncomfortable finding, but it's one that has to be acknowledged, George.
Very troubling indeed. Now, finally, and I'm grateful for your time as always, 4/5 of the British public in the opinion polls support the line I took in the short that I did for RT just a few minutes ago, that people should not be forced to work, either by poverty or by diktat. And those pushing now, in the interests of the establishment and business, to reopen the streets, the shops, the workplaces, and so on, only a fifth of the people of Britain agree with that. Where do you stand on this? Lockdown or no lockdown?
So, I mean, if you look at Michael Gove's response to his questioning about mass testing, he really ducked the issue. He was asked very directly, is it possible to avoid, would it have been possible to avoid some of these deaths if there was a much better strategy of mass testing earlier on? And unquestionably, the answer to that has to be yes. He said it's unknowable, but it's quite clearly evident from other countries' strategies that they haven't experienced what we have precisely for that reason. And it's hard to see a strategy of coming out of lockdown that doesn't involve a substantial increase, second peak of infections without a very much improved mass testing, contact tracing protocol. Now, there have been announcements from the government that they're planning to put this in place, but it's very late and it's still very rudimentary, and it doesn't inspire confidence. So given the current situation, I think China has shown, Vietnam has shown it's possible to come out of lockdown if you have the virus under control. And the only way of controlling it are very extensive, basic public health measures, which have been really, ignored and flouted by this government. There's been a lot of controversy this week about why that is, but increasingly it seems to come back again and again as scientists are worried that they are going to be carrying the can for the government, who are constantly saying that they're only following the science. They're increasingly pointing back to the contribution of Dominic Cummings, plus or minus Boris Johnson, that this was essentially a policy driven by economics, the laissez-faire policy of allowing the virus to spread through the population, herd immunity. We don't have to recapitulate it all, but essentially they were more concerned about the economy than they were about the health of workers' lives. If we are going to put the health of workers foremost, then we would have to say it's not safe to end the lockdown at this stage. I'm desperate to get past this, but we can't do it without knowing where the virus is and isolating it from the community in a safe way. And that's why really at the moment the government are basically saying we're not going to have completely clear way out of lockdown until there is a vaccine.
And how far away are we from a vaccine? One hears so many varied guesstimates. English universities talking about perhaps July, but others talking about perhaps 18 months. What's your best estimate?
I mean, there are teams all over the world, from the Serum Institute in India to the Academy of Military Sciences or Medical Sciences of the People's Liberation Army in China, to GlaxoSmithKline. So everyone is looking for this virus. For the vaccine to this virus. I think the PLA in China are the most advanced in their testing. They're in the second phase of their clinical trials. So essentially, they have a vaccine that they know is safe, and they're in the large second phase trial. They've got 500 people in it, which they're trying to work out whether it's efficacious, and if it is, then they'll go into a mass production phase and larger trials over a large number of people. I think it's very unlikely our government will buy that vaccine from China or accept it from China. It is, a feature, quite a negative feature of our response in Britain to this has been ignoring a lot of the lessons of other countries, China, but not only China, also Korea, on the basis that our science is superior. But there's an underlying business reason as well, that if our large pharmaceutical industries produce a vaccine which is viable, they'll make a great deal of money domestically and internationally from selling it. So I think vaccines will be available. I think the Chinese are likely to be there first, but many other people around the world will produce, probably independently, and will probably have several vaccines on the market, I imagine, towards the end of this year. But these things have an extended timeline, and it's hard to pin down exactly when it will be. I have seen people, for the reason that, medicine, the selling of medicines, the pharmaceutical industry is such a multi-billion-dollar industry, people are very distrustful, and there's increasing kind of feeling of an anti-vax campaign even around this issue. But I must stress that vaccines are effective, that a vaccine will protect millions of people who haven't had the coronavirus. But I think there's no way out of the fact that we need much better basic health measures of adequate testing, adequate contact tracing, and keeping those who have the virus protected and isolated from the community who don't.
Put me down for a Chinese vaccine and include me in the demand for the nationalisation of the pharmaceutical industry. Dr. Ranjeet Brar, thank you very much indeed for joining us.